Plastic surgery is trending on TikTok, and one doctor has amassed quite the following with more than 7 million followers. I hate you. Joining us is board-certified plastic surgeon, my colleague, Dr. Ricky Brown, AKA the Real TikTok Doc.
Here I am.
I've seen your TikTok. It is hilarious. I could sit there and watch it for days. I don't need TV.
Well, what things can they just not get enough of as far as your video clips?
I mean, my followers love the gore. They like to see surgery. The more the better. Like the ones that don't follow me obviously don't like it, but the ones that do are always begging for surgery. They love the gory stuff.
They want to see some meat, right? That's like when my kids were both doctors, used to come watch me do some stuff, and they go, well, Dad, can I see some meat? You know.
You probably have a ton of doctor followers.
Oh,
Doctors watch this stuff, and you know, we're talking about this do-it-yourself YouTube stuff. Doctors kind of go and watch YouTube and learn not how to do the procedure, but tricks on it. And this is a great way to show other doctors too, because you have these videos and doctors can watch it. And even with Instagram, we used to have to wait for lectures and publications. You got to publish something, a doctor is slowly going to read it a year later. Now you just post it on your Instagram. Look, I developed this technique, and everybody sees it.
Yeah, I've gotten to meet so many incredible doctors through social media and TikTok especially. I mean, people that I message with, and like you said, I'll ask them a question like, hey, I saw you post about this procedure. Tell me about that, and I might use what they've told me.
Well, let's get to a few body-related plastic surgery topics since we have our expert with us today, topics that are clearly trending on TikTok. So here you're showing what a 30-year-old breast implant looks like. That's pretty funky.
Yeah, so this patient, as you guys obviously know, we get patients who have implants that could be 15, 20 years old, and this one was ruptured. And these are our first generation silicone implants. So what I'm showing here is how liquefied they are, right? Today we have 5th generation gels, which are more highly cohesive gels. And so we don't see this very often, but those, you know, people love to see the gross, but it's amazing what we see and what we take out of patients.
You know, I practice in Beverly Hills, but I also practice in the Palm Springs area, and I affectionately call it the graveyard of old breast implants. I don't know why so many old implants have ended up in the desert, women that had these done in the 70s.
If you haven't...
In the 80s, in the 90s. And as you alluded to, I mean, you can see some really horrific things. I mean, capsules that have turned in, that are calcified, that have literally turned into bones. So how long should somebody leave implants in? I know the implants we use today have a much longer lifespan than in the past. So what's your input on that?
There is no hard and fast rule. You don't have to go change them at 10 years. There's no scientific evidence at this point that supports saying you have to do it at 10 years. However, you should get examined. You got to get examined. You have to have someone look at it and say, you know what, you got some malposition. You got some contracture happening. Somebody did an over-under on this side. They went completely under on that side. You look asymmetric. Things might be wrong. Or you've got this implant that should have been recalled and nobody told you. So getting examined is important. As far as doing the change every 10 years, or, you know, if it's 30 years old, okay, maybe upgrade to a newer implant because we have better technology within them, more cohesivity and those kind of things, which if they rupture, if ever, they're going to cause less of that dispersed kind of problem in people's bodies.
But Dr. Brown, I mean, you see it. Today's implants are so much better.
Yeah, they're so much better. When they rupture now, it's like they literally are the gummy bear. We call them the gummy bear gel, and they're all congealed together, so it's a lot easier to take those out than that soupy molasses that you just saw.
And I've always liked gummy bears better than molasses.
Yeah, me too. Me too.